Wait until the client appears interested, you may be waiting for some time. A regular schedule provided by the nurse will give structure when the client is having difficulty making decisions. The next important topic is related to suicide. Suicide can stem from depression, especially in the elderly and with male substance abusers, with a history of previous attempts. Danger signs include giving things away, making amends, verbal threats, a specific plan, and when the client appears to be getting better. It is between the periods of mania and depression when the client is most at risk. When the client is very depressed, the individual does not have the energy, and when the client's mood is elated, the individual appears not to have a care in the world. It is very appropriate to ask a suicidal client if they have a plan. It is important to remember that asking a client, "Are you suicidal?" will not encourage someone to kill themselves. The next question is from Test 3, number 23, and is about suicide. The nurse asks a suicidal client to make a safety contract, whereby he promises that if he has thoughts of harming himself, he will not act on them, but will discuss them with either her or another staff member. The client tells the nurse that he cannot make this safety contract because he cannot promise that he will not harm himself. In the nurse's plan of care, which initial action would best ensure this client's safety? Number 1, provide a relaxed and accepting environment to develop trust. Number 2, sterilize the environment by removing belts, glass objects, or sharp instruments that could be used for self-harm. Number 3, lock the doors to the unit and secure all windows so they cannot be opened. Or number 4, assign a staff member to stay with the client at all times. Number 4 is the correct response. Assign a staff member to stay with the client at all times. The client who is at high risk for suicide will require constant supervision at all times. An important tip to remember is that safety is always first. The nurse is legally and professionally responsible to provide safety. Removing sharp objects is always important, as stated in choice number 2, but does not guarantee safety. The next topic to be reviewed is electroconvulsive therapy, ECT, often known as shock therapy. ECT is done mostly for severely depressed clients and is effective in remission of symptoms. The nurse must ensure that the client is safe during the procedure and provide appropriate support to the client. Generally, temporary memory loss and confusion are the most distressing side effects. The next question is from Test 7, number 64, and is about ECT. The question reads, which of the following is true regarding ECT? Number 1, usually requires 10 days to 3 weeks before depression is noticeably improved. Number 2, results in a high incidence of chronic memory problems. Number 3, is effective for 60% of persons who receive it. Or number 4, is used for persons who have not responded to antidepressants. Number 4 is correct. It is used for persons who have not responded to antidepressants. ECT is not the first choice of treatment for most depressed persons. Antidepressants and psychotherapy are used initially to treat depression. The side effects of memory loss are short-term and are transient for clients receiving ECT. ECT is 80% effective with depressed persons and works rather rapidly as a treatment modality. The next 2 questions are related to medications used to treat mood disorders. Lithium is the drug of choice used for bipolar disorders with mania. tricyclic antidepressants, TCAs, and monoamine